Hello and welcome to Health Matters on Channels Television. Thank you so much for joining us. I am Mary Alale Yusuf. Experts say the heart pumps over 5 liters of blood every minute, and cardiovascular diseases or CVDs are the leading cause of death globally. According to statistics from the World Health Organization, approximately 17.9 million people died from CVDs in 2019. About 85% of them were due to heart attack and stroke. Over 3/4 of CVD deaths take place in low and middle income countries. According to the World Health Organization, most cardiovascular diseases can be prevented by addressing risk factors within our control, such as tobacco use. As with many other conditions, experts emphasize the importance of detecting cardiovascular diseases as early as possible for more effective management. My guest is past president of the Association of Cardiovascular and Thoracic Surgeons of Nigeria and an associate professor of cardiothoracic surgery at the Lagos State University Teaching Hospital. Dr. Bode Falashe, you're welcome to the program.
Thank you.
When we talk about heart health, we always hear the word cardiovascular. I know cardio means heart and all that, but do all diseases of vessels involve the heart?
The heart is central to the body. So when you say cardiovascular, because the heart pumps blood around the body, it's all interrelated. So quite often, diseases of the heart manifest in the heart, but quite often, like say you have atherosclerosis, it also manifests in the vessels of the body, which are connected to the heart. Yeah.
Just because the heart also supplies those vessels?
Yes, it's the central engine.
Okay, so early detection is emphasized. What do you find in early stages of cardiovascular disease or signs which could compromise heart health that one can point to? I mean, when you say early detection, the person who has the problem should know what they're looking for in order to present early. So that's what I'm asking. What are those early things?
Okay, that's a very good question. Heart disease can be the silent killer, but some things are more obvious than others. We had the World Heart Day yesterday.
That's right.
Use hearts, no hearts. That means you must understand your hearts. You must also understand the things that you can do that can make your heart healthier or worse. We have a number of things. Blood pressure control, weight control, activity, your mental stress.
So those are things that, contribute to heart health or otherwise.
Yes.
But what I'm asking is, what does the patient see or feel to know that there's a problem?
That's where I was going to. So if you look at those things, blood pressure, activity, your weight, mental stress, cholesterol, diabetes, some can be seen, some can't be seen. So things like checking your blood pressure on a regular basis. You see your blood pressure is creeping up. You mentioned stroke earlier. So you may see that your blood pressure is going up. You don't want to wait until you have a stroke, because if you feel at that point, it's probably too late. Same thing, your blood sugar, you're diabetic. You need to control the blood sugar. Diabetes affects different organs of the body. By the time you feel diabetes, it may be too late. Same thing with your weight. Weight is one of the biggest things that causes heart disease.
One of the biggest?
One of the biggest. The American College of the American Heart Association, some years ago, came out with a paper that said that 40% of cardiovascular disease could be reduced by losing weight.
Wow.
Yes. Most Americans, it's not just Americans, but in America, they have a problem with obesity. We're correctly
We're getting there in Nigeria,
We are.
We're really getting there with the way we eat.
Definitely.
Fast food and all that.
Yes.
But now, having spoken about diabetes,
Okay.
Is that the reason why they say cut sugar?
Yes. Essentially, yes. So,
some people say they burn their calories faster than others. Should those people also be bothered about their sugar intake?
One has to take a holistic approach. I would say too much of anything is bad. Is sugar bad? No. In excess? Yes. Is salt bad? No. We put salt in our diets. But excess salt is bad, can lead to hypertension. So I think it's all about living a healthy lifestyle, having the balance. So,
Okay,
yes.
so why is obesity such a criminal in this matter?
Okay, very good question. Obesity, if you're overweight, the heart is taking the load.
Okay.
So, say you were in school, you were 70 kilograms. The body and the heart is used to working within that 70 kilograms. You then gain weight. Say you gain 40 kilograms.
And you're now 110.
You're now 110. You're putting more stress on the heart because the heart has to pump blood through the vessels. And apart from the increased stress on the heart, you have stress on the joints. By being obese, what's causing the obesity? Extra fat. Where does the fat go? Different parts of the body. Is fat healthy? No. Excess fat isn't healthy. So the obesity is a sign that you're at risk of many cardiovascular diseases. People who are obese tend to be diabetic, hypertensive, they have high cholesterol, which are all the precursors of major problems.
Okay. You say it's stressing the heart.
Yes.
Yet you also say physical activity is good. Doesn't that stress the heart?
Controlled. So when I say controlled, what is stress? Stress is something that you don't anticipate. If a lion came in here now, we would both panic and run. We have the adrenaline rush, we are dashing out because the body, that's the fight or flight response. When you do that, you have a lot of hormones that are being released to drive the body into action.
That's right.
Okay. When you exercise, and it is a gradual process which you do on a regular basis, not just a one-time stress, then you are burning off fats. You're keeping yourself fit. You're getting the heart pumping. And by exercising that balance of intake and output, you're not putting on weight. You're controlling the weight. So the factors I mentioned earlier about weight control, your exercise helps you with the weight control.
Okay, so let us look at what we've been skirting around since. Lifestyle changes.
Okay.
What are those things, first of all, that we can't change, that are sort of risk factors for heart disease or cardiovascular diseases?
Okay. One major thing we can't change is living in Nigeria.
You said Nigeria.
Yes.
You didn't say Africa.
So living in Nigeria, right now we're in Lagos, we're in Nigeria. So unfortunately, stress is part of our life. We live in the city, not in the villages. Noise pollution, traffic, getting to work on time, traffic jam, noise pollution. In fact, for me personally, I find the noise pollution terrible.
So it is true that such things
Yes.
contribute.
Contribute because chronically you're being exposed to those things on a continuous basis. I mentioned before we started this talk that we have one of the highest rates of hypertension in the world. The stress of the environment definitely contributes to that.
Okay.
And we're also going through tough economic times. So even when you don't have the stress, there's also the mental stress.
That's true.
Yes.
Okay, so let us look at the modifiable ones, the ones we have power over, which the World Health Organization says can actually slice the numbers of heart disease if we pay attention to them. I mentioned tobacco use in the first, when we started. You have spoken about the way we eat.
Smoking, weight control, staying active, trying to reduce the mental stress. Check yourself for diabetes. Check and control for cholesterol. Avoid alcohol. Avoid high levels of salt. Those are some of the things that we're trying to promote for the World Heart Day. In understanding your heart, what things should you avoid? Those are the main things you should avoid.
So let's make this clear.
Okay.
You are saying that these are the things we should do, but you don't necessarily see a heart disease coming on. You don't necessarily see a cardiovascular disease coming on, but you control it before you begin to see signs.
Correct.
All right.
Correct.
So what does the doctor see to diagnose a person with such a problem?
Okay, very good
Say
question.
now you have a heart disease.
Okay. Different things. We were at the Ipodo market yesterday as part of the World Heart Day, and we did blood pressure checks. We checked for blood sugar, and people who are overweight, we also assess them, see if they were excessively overweight. So some of those things you can see. You can check the blood pressure, you can check the blood sugar, you can check the person's weight. Beyond that, it's now the things that you can't see, which we mentioned about earlier, in terms of, are you staying active? Are you fit? Are you reducing your stress? Then if I talk to a person and they say, oh, I smoke, I drink, I'd also advise you, if you can, please stop smoking. Alcohol, try to limit it. Salt, reduce. So it's a mixture.
Okay, so salt you can reduce, sugar you can reduce, alcohol and tobacco you can cut off.
You can cut off, yes.
Stress you cannot. Do
but
you have
can-
ways
but
you can at
reduce.
least manage the stress so that it doesn't affect your health?
Some, you look at things that you can modify. Personally, what I do is try to limit stress. Is I work hard, but I also try to leave time for relaxation. It's something we can all work towards. For me, my main relaxation is playing golf.
Okay.
So I try to make time for golf every week. So I have those few hours of escape where I'm not thinking about the heart.
Although I don't see golf as a very energy-intensive sport.
No, it's not it is the relaxation.
Okay, so can somebody relax sprinting, for example? Maybe that's what the person likes to do.
Okay, let me say you can relax sprinting if you know that by sprinting, you're keeping yourself healthy. Then that is also mentally relaxing.
You make it look like your mind and your body must agree for it to work.
True. True. Yes.
Okay.
Because stress, we can't see the stress. So whatever you do that you enjoy doing, that helps you relax, is definitely reducing your stress.
I see some articles that talk about 0-calorie sweeteners that say these things cause heart disease. Is it true?
One shouldn't put a yes or no answer to that kind of question. Why do we have sweetness in the first place? Because we're trying to reduce the amount of sugar that we're taking. But these sugars also contain saccharin. And in excess, so these sweeteners also contain saccharin. And in excess, that can be bad. So back to what we said at the beginning, everything in moderation.
Okay. Do the parameters that cause heart attacks and heart disease, do those parameters also cause strokes?
Yes, they do.
I'm seeing a lot of strokes in Nigeria these days. Yeah. To me, it looks as if the cases are becoming more, but I'm a human being, so I can allow for human error. Maybe they just happen to be close by. But what is your opinion?
It is on the rise, definitely. And that is because we're not always able to identify those lifestyle modifiers that we can control. If people control their blood pressure, their diabetes, their cholesterol, those are the main things that are risk factors for stroke. So you've got a patient who is hypertensive, overweight, has a high cholesterol, uncontrolled diabetes. The person is a sitting duck to develop a stroke. Yes.
How many of those parameters do you need to be concerned?
Oh.
No, what I mean is, sometimes people say, oh, there are several things that could cause a problem. Maybe there are 6 of them, 7 of them. But if we see 3 together, trouble. Again, if it's 1, okay, we'll let you go.
No. Again, I repeat, all.
So once you just have one indication.
Let me give you an example. If you have severe hypertension, your blood pressure is 200 over 140 continuously. You're not diabetic. You're not overweight. That one thing, because that one factor is not controlled, can lead to a major stroke.
Okay, let me just pause you there. We have to take a break. Okay. We're going for a break. We'll be back shortly. Stay with us. Welcome back. This is Health Matters on Channels Television, and we're discussing heart health with Dr. Bode Falashe. So, you can call if you have a question about heart health, how to find it, what to do. call 0808-054-2233. You can you can send a message on X at CTV_Mary A, or send me email, moalale@channelstv.com while the program continues. So let's assume somebody didn't get his symptoms in time, didn't check his numbers, and already has a problem. Perhaps he has 2 or 3 of these parameters: high blood pressure, obesity, maybe high cholesterol, and his heart is having a problem.
Okay.
Do you have, can we still intervene?
Definitely.
By medication or surgery or something to correct the problem?
Definitely we can intervene. I love that question. The intervention will depend on what problems the person is presenting with. If it is still within the realms of controlling the person's blood pressure, controlling the blood sugar, then medications.
Okay.
But sometimes damage has been done.
Done already.
So for example, let's say the person has had diabetes, high cholesterol, and there's now thickening of the arteries of the heart. You have atherosclerosis. The person gets chest pain. And then you think, could this person have a blockage of the coronary arteries? You would then run various tests. And if there's a blockage, you then advise at that point, we need to intervene to open that blockage. That could either be with the cardiologist in the cardiac cath lab or with the cardiac surgeon in the operating room. So that's one example I'm mentioning to show that we have the full range of intervention now in Nigeria. Medications, we have the cardiologists who do medications, we do. The interventional cardiology, say you have a blockage of the artery, we have cath labs.
I hear that there's an injection they can give a person at the time of attack, which they call it a clot buster. We have that?
Yes, we do.
Hooray.
We do. So that still falls under the medications. But it's also awareness. Just what you said now. Somebody has an acute heart attack. Time is health, or time is heart. Let's assume the artery is blocked. If you don't unblock the artery, within 60 minutes, the major damage has been done. So awareness as well. What do I do? Where do I go to? Which hospital? So there's work to be done in terms of raising awareness. Can I get an ambulance to take me to the right place?
But can I? Can one?
I believe so. Yes, you can. I mean, Lagos State has numbers that you can call.
You spoke about some sort of register. Tell us about this register, this heart register.
Okay, thank you very much. That's my pet topic. I spoke about awareness. Part of the awareness we're trying to raise is that there's now much more activity in the space of heart surgery, open heart surgery. A few years ago, my colleagues and I came together and we designed an online registry, which is voluntary, so that right now we have a registry that contains all the heart surgeries done in Nigeria since 2004 to date. So that gives us an evidence base. It also helps the public because this registry is available
to
online.
everybody.
Yes. If one Googles Nigeria Heart Registry, it's the very first hit in Google. That registry will allow you to know which centers are doing heart surgery, what types of surgeries. Yeah. So it will be a very good one. So the reason for the registry is to raise the awareness. I feel very unhappy when I see people who have problems with cholesterol in Nigeria still jumping onto a plane and going out. If you go out by choice, all well and good. But if you're going out because you're not aware that there's a solution in Nigeria, then I can get a bit upset.
Let's talk about somebody who is having an incident, for example.
Okay.
Maybe there's a heart problem, and the person is now feeling it, knows that, okay, there's something going on. Can they use this registry to help them maybe locate a close-by place that is within the 60-minute window so that something can be done?
Yes. We need more registries. But with our registry, it indicates all the contributing institutions, which are cardiac centers that offer both cardiology services and cardiac surgery. And the registry contains the contacts of the people. So with that registry, if you say you Googled and you had Lasuth, you'd see my name, you'd see the names of the cardiologists, or you came up with First Cardiology or Evercare, you'd find the name of the institution and the contact person of who to
so at least
yes.
there's a closer contact
Yes.
with the healthcare industry
Yes.
for such things.
Yeah.
How involved is the healthcare sector with advocating for policies that that help the heart? For example, some countries have this thing about tobacco. They go all out. You can't advertise at certain times. You have to put horrible warning signs on the front of the tobacco, whatever. And then there are some places that are restricted. You can't smoke here, just to help people with their heart health. How involved is, the Nigerian health sector with that?
See, that is why we need registries. What you just described now, say in the US, smoking kills. There's been evidence-based that shows that smoking kills. It's not extrapolated from others. So you can say in an environment, you take this, you do this for X number of years, these are the kind of diseases that you would get. So more and more, we're getting more registries, more evidence-based that helps us make these decisions. Because if you're trying to affect policy, the policy makers want to know the ABC.
They want to know, have the proof.
Have the proof.
Of
yes.
Yeah, you see, that's one of the problems we have.
Yes.
Is data collection.
Correct.
With your registry, I mean, with the way Nigeria is, how effective is this thing going to be?
It is extremely effective. The good thing is everything starts slowly. I wish we had the registry up, but if you see the registry, you see the graph.
Okay.
One, of activity, but secondly, of contributing institutions. Everything starts slowly. When we first started the registry, only a few institutions were interested. Over the years, more and more institutions have been coming on board. Right now, we're probably capturing at least 90% of the activity in the country. Only yesterday, a colleague in Abuja sent me the data for the surgeries that they do in Abuja.
Oh, good.
Yes, so it's something that is gathering momentum.
Is there any heart disease that cannot be handled in the country?
I would confidently say we can handle 90% of disease that requires intervention in the country. There are sometimes some options which you don't have yet. Let me use the heart valves, for example. We can replace heart valves. We can repair heart valves. But the common trend in the Western world is replacing heart valves with what you call a stentless valve through the vessel.
Okay.
So rather than opening you up, we put it in through the vessel.
Okay.
I have colleagues.
That's minimal invasive.
Minimal invasive, yes. And I have colleagues who are working on that. So I'm happy to say that there are many companies that are actually supporting these efforts. So we easily have 90% of what is required in the heart surgery cardiology space. And every day, every month, every year, we're getting more and more. So I'm really excited at the growth I see in cardiology and cardiac surgery in the country.
Okay, so in 30 seconds, just tell somebody who is a layman, who doesn't know all this jargon, how to take care of the heart.
Okay, in 30 seconds, how to take care of the heart. Stop smoking. Exercise. Watch your blood pressure. Watch what you eat. Don't load yourself with carbohydrates, with fatty foods. Eat more vegetable, eat more fruits, more protein. That's the 30 seconds.
Thank you so much for coming to the show, Doctor. It was beautiful having you. And thank you also there for being with us. Let me add, that blood pressure you're checking has got to be deliberate. You've got to go to the hospital yourself. Don't wait for the signs and check that blood pressure. Thanks for watching. I am Mary Alale Yusuf. See you another time.